The transplant team is sort of the model of what we consider multidisciplinary care. There isn't one member of the team that really totally leads the ship. And it really takes sort of a holistic approach to how to give these patients the best care. And it requires all the different disciplines working together. I'm a multi-organ abdominal transplant surgeon. So we do transplants on livers, kidneys, and pancreases. What I really love being part of Scripps is how much it feels like a family. I know at any time I can pick up the phone and call a colleague and say, hey, listen, I have a patient. Can you help me with this? What do you think about this? Let me run this past you. There's this constant integration and discussion and collegiality that I really enjoy. But it's not just the physicians. It's the doctors, it's the nurses, it's the patients, it's their family. Everyone sort of needs to come together to provide the patient the best possible care they can get. All that we try to do is help patients have autonomy, to have say over their lives. I can offer patients lots of different options, but it's really my job to educate them, educate their family, so that they understand what their choices are and they can make a choice that's the most consistent with their wishes, how they want to live their lives. And one of the things I've always really admired among a lot of my colleagues at Scripps is how many people try to do that. When a patient comes to see me, I think of as they're coming to see my team. It's not just me. It's all the other healthcare providers. It's the schedulers up front. It's the MAs rooming the patient. It's everyone, the coordinators. It's all about them being heard and feeling respect. They're coming in scared. They're coming in trying to understand something that they probably don't have any experience with. They may have experience with illness, but whatever is coming that's bringing them to me now is usually something pretty dramatic. What I love now is seeing patients get to go home, be there and watch their kids grow up, watch them graduate, get jobs, get married, have kids of their own. What I love is giving patients their life back.